If you've ever had a shingles outbreak, then you know how painfully debilitating it can be. On a pain scale of 1 to 10, with 10 being the most severe, patients commonly describe their pain between a level 8 to 20, meaning the pain can feel beyond severe and beyond miserable. Well, just a few months ago, I unexpectedly was struck down by the Shingles Monster, and yes, it was a beast. This gave me the opportunity to experience firsthand what many of our patients go through. Honestly, it was an experience I never want to repeat. Needless to say, this motivated Dr. M and I to dive into the research deeper than we ever have on this topic. So in today's video, I'll cover what exactly is shingles, what triggers an outbreak, proven effective treatment that I used on myself and many of our patients with great success, how to reverse post-herpetic neuralgia, and most importantly, I'll show you how to avoid the pitfalls of shingles and prevent a reoccurrence. Don't go anywhere, it's gonna be good. Hey gang, Dr. C here. If you're ready to conquer your peripheral neuropathy, reclaim your life, and start living again, then subscribe to our channel and don't forget to click on the bell to get notified as soon as we publish new content. Now, let's get started. Did you know that shingles affects 1 million people every year and the number of cases is steadily rising? Shingles is an infection caused by the varicella zoster virus, sometimes called the herpes zoster virus. The virus causes chickenpox in children. Once you've had chickenpox, this virus can remain dormant in the nervous system for many years, even decades before you could potentially experience an outbreak. The shingles virus is part of the herpes family, but it's not the same as herpes simplex type 1, which causes cold sores in the mouth, or simplex type 2, which can cause genital herpes. The shingles virus is more like the cousin of these two herpes virus and is classified as herpes type 3 or herpes zoster. Now, I have to tell you, I was completely thrown off guard and completely shocked when I experienced a shingles outbreak in November of 2023. Never in a million years did a thought occur to me that I could get shingles. After all, I eat healthy.
Shingles doesn't care.
I'm in great shape.
Shingles doesn't care.
I work out daily and I have my entire life.
Shingles doesn't care.
I maintain a 10% body fat and my lab values are excellent.
Good for you. Shingles doesn't care.
That's absolutely correct. Shingles doesn't care. I mean, talk about the irony, right? The nerve doctor gets struck down by shingles. So let me begin by explaining how you get shingles in the first place. If you contracted chickenpox as a child, this virus, known as the varicella zoster virus, stays in your body long after the chickenpox subsides. It hides in a part of the nerve cells called the ganglion, where it'll take up permanent residency, and it can stay dormant for years or even decades until your immune system gets drastically worn down. This virus is very opportunistic, so when your immune system is constantly taxed and in a state of chronic weakness, the virus will rear its ugly head and bam, you get a shingles outbreak. What caused my shingles outbreak was a drastically worn down immune system. Here's what happened. Our beautiful St. Bernard Brandy was suffering from this mysterious skin condition that no vet could identify. As a result, she would scratch so much that she began cutting her skin, causing these open sores. So Dr. M and I went on a research mission to uncover the root cause of her problem, which took a few months. Meanwhile, Brandy would wake up 2 to 3 times a night in this itch and rage. So Dr. M and I would get out of bed several times a night to apply this herbal ointment to her skin. Then we'd give her an herbal antihistamine to calm her itching down. And then we'd stay up with her until she was comfortable and we could get her back to sleep. Now, this went on for a few months. Oh, by the way, don't worry. Brandy is fully recovered and completely healthy now. Okay, so let's connect the dots. After a few months of sleep deprivation, getting up between 2 to 3 times per night, coupled with chronic high stress from my career, well, that began to tank my adrenal glands. Now, adrenal glands are these small walnut-shaped glands that sit on top of your kidneys and are an important player in the health of your immune system. Then, to make matters worse, my two biggest outlets for stress reduction are my workouts and meditation, and both of these were obliterated since I wasn't getting enough sleep at night. I didn't have the energy to work out, and when I would try and meditate, well, I'd just fall asleep because I was exhausted. I had redlined my immune system, and that led to the perfect storm. Now, you've probably heard many doctors say that the risk of shingles increases as you get older. And although this is true, it has nothing to do with how many birthdays you've celebrated. The reason is simply because as you get older, our immune system typically gets weaker. Part of the reason is due to the normal wear and tear, or the mileage you put on your body, which can be mitigated to a certain degree by taking immune booster supplements and adopting a healthy diet. However, the biggest reason your immune system weakens with age is because of neglect and abuse of your body. Whenever your immune system is in a habitual weakened state, it doesn't have the ability to fight off the herpes zoster virus the way it normally would, resulting in the shingles outbreak. Now, this is actually great news because it means you're in complete control of preventing shingles and keeping it in remission. So a bit later in this video, I'm going to arm you with scientifically proven, powerful tools on how to sidestep shingles altogether. I do want you to realize there are other triggers besides lack of sleep that can constantly suppress your immune system. So let's look at the most common things that can trigger shingles. Number one on the list, chronic stress. Being subjected to constant elevated levels of stress will cause perpetual release of cortisol, which over time severely weakens your immune system, providing the perfect platform for an outbreak. Number two, vitamin D deficiency. Vitamin D plays a pivotal role in modulating your immune function. Do you know that statistics show that 42% of adult Caucasians are deficient in vitamin D, while 63% of Hispanics and 82% of African Americans are deficient, and this is only the adult population. 70% of children have this deficiency as well. Maintaining optimal vitamin D levels will keep all viruses suppressed, including the shingles virus. Now, don't worry, I'll go over what optimal levels should be and how to get there later on in this video. Okay, let's go on to the third thing that can suppress your immune system, medications. Certain medications like asthma medication, corticosteroid meds like prednisone, and statin drugs weaken and suppress the immune system, raising your risk for an outbreak. Okay, number four, cancer treatments like chemotherapy, immunotherapy, and radiation can trigger a shingles outbreak. Let's go on to number five. This next one might come as a bit of a shock to you, but radiation exposure from X-rays, CT scans, or even extreme irradiation from the sun, like when you get sunburned, can also trigger an outbreak. But wait, there's more that can trigger shingles, like a bad diet. Also, pesticides and herbicides. If you're eating conventional produce that has been sprayed, well, research has shown that this has a direct impact on weakening your immune system. Now, although buying organic is definitely more expensive, it doesn't have to break the bank if you're on a tight budget. For instance, you can focus on buying just the Dirty Dozen fruits and veggies organically. Now, the Dirty Dozen is a term coined by the EWG, or the Environmental Working Group, that ranks the top 12 produce with the highest concentration of pesticides, herbicides, or fungicides. Also, Costco now carries a significant line of organic produce at reasonable pricing. Okay, now let's also talk about health conditions that might make you more susceptible to a shingles outbreak. Conditions like high blood pressure, diabetes, elevated cholesterol, and we're talking specifically about the bad cholesterol like the SD, LDL, and triglycerides. Also on this list are COPD, depression, hypothyroidism, and multiple sclerosis. Any of these conditions will increase your risk of a shingles outbreak or recurrence, but two or more of these drastically will increase your risk. Now, I want to hear from you. If you've had shingles, leave me a comment and tell me which of these triggers brought on your attack. If you've never had shingles, it's important to recognize the early warning signs before the actual outbreak. Recognizing these signs can save you a tremendous amount of agony. So early symptoms of virus activation can occur 3 to 5 days before you notice any skin eruptions. You might feel skin sensitivity, tingling, itching, or even prickling sensation that only occurs on one side of your body. Typically, it's going to be on your torso, your neck, head, ears, or face. And it'll be in a small patch or a band-like area. As you can see by the residual scars on my head, which fortunately continue to fade, it affected the right side of my head and my right eye. Now, here's an important side note, health warriors. If this ever happens to you, and I pray that it doesn't, if it affects your head and your face close to your eye, you need to see an ophthalmologist immediately to make sure that you don't suffer from any eye damage. When shingles affects the eye, it can lead to partial or even complete blindness in the affected eye. I was really blessed. It didn't impair my vision at all. Other symptoms you might experience can include unexplained fever, headache, or even stomach upset. In my case, I noticed a prickly, tingling sensation on the right side of my head and face. And it wasn't painful, it wasn't even constant, so being the wise doctor that I am, I ignored it like most males would. After all, it wasn't slowing me down, and I had way too much on my plate to pay attention to this itty-bitty tingling sensation in my head. Yes, even as doctors, we're not exempt to those stupid moments. Well, somewhere around 2 or 3 days later, I noticed a couple of red bumps on my head that I chalked up to razor burns from shaving. That was until those red bumps continued to multiply and turned into fluid-filled blisters. It took that on top of the electric shock-like pain for the light bulb to go on and realize I was having a shingles outbreak. Now, if all of that wasn't bad enough, I also developed a secondary bacterial infection called cellulitis once the blisters began to rupture. The swelling in my face was so substantial, I was unrecognizable. Now, I have to tell you, I have an extremely high pain tolerance, and it's rare for me to take pain medication for anything. But this pain was so severe, I ended up in ER. Now, just to recap, if you're experiencing skin sensitivity, tingling, itching, or prickling sensation, or red bumps in a very targeted area on one side of your body, face, or head, assume it's shingles and follow the steps I'm about to outline for you in the treatment section of this video. These steps can prevent a full-blown, horrifically painful shingles outbreak, especially if you can catch it before the red bumps appear. And if by any chance it's not shingles, the natural treatment methods won't hurt you at all. So trust me when I tell you, you'll be happy you played it safe. So let's talk about treatment options. Traditional treatments for varicella zoster are antiviral medications like acyclovir or valacyclovir and pain medications. Unfortunately, neither of these antivirals cure or eradicate the virus. They will only slow it down, which is important if your shingles is mild and you want to prevent it from becoming severe. But here's the problem. Unless you catch the virus within 72 hours of the outbreak, these medications aren't going to be very effective. Now, here's another problem with these meds. Research shows that both of them can cause acute kidney injury, even for healthy kidneys, and they can potentially cause altered mental states. These drugs also have been shown to play a role in neurotoxicity or toxic damage to the nerves, which can result in continued nerve pain long after the shingles attack has been resolved. This is a condition known as postherpetic neuralgia. Now, let's turn our attention to more holistic treatment options. Medical research reveals there are proven effective all-natural treatment approaches to herpes zoster. So let's look at these safe and natural approaches. The most important place to start is by looking at your vitamin D levels. If you don't know where they're at, then you need to get a simple blood test to find out. Your doctor can do this for you, or you can use a walk-in lab like any lab tests now and get your levels tested. Now, the normal range listed on lab tests will be somewhere between 30 nanograms per milliliter to 100 nanograms per ml. But this isn't truly an accurate range. In order to achieve and maintain great health, the optimal levels of vitamin D should ideally be between 60 and 100 nanograms per ml. When your vitamin D levels begin to drop below 50, you're already deficient, and below 30 means you are severely deficient. Now, here's a frightening statistic reported in this research study. Vitamin D screening assay is readily available, but the reported lower limit of the normal range is totally inadequate for disease prevention. Based on the epidemiological studies, approximately 75% of all adults worldwide have serum vitamin D levels less than 30 nanograms per ml. So it's no wonder we're seeing an incredible insurgence of the initial shingles outbreak and recurrence, because vitamin D plays an important role with combating the virus and keeping it in remission. Increased levels of vitamin D will push the shingles virus back into remission. You'll need to take 50,000 IUs of vitamin D along with 500 micrograms of K2 daily until the virus is back in remission. Too much vitamin D without K2 will cause calcium deposition and buildup in soft tissue of your body. So it's important to take the K2 because it will assist in driving the calcium into your bones where it should be. Also, when taking higher levels of vitamin D, it's important to also take magnesium. Your magnesium levels can become depleted with higher levels of vitamin D. You'll need to take at least 400 milligrams of magnesium glycinate daily. I recommend the glycinate form because this form doesn't cause you to develop loose stools. Now, you might think that 50,000 IUs is way too high and may cause vitamin D toxicity, but it won't. The reality is that toxic effects of vitamin D only occur if you're taking 150,000 to 200,000 IUs daily over a long period of time, especially without K2. The next thing you'll need to take to fight shingles is L-lysine. Now, this is an amino acid with strong antiviral properties, and it doesn't just work on the shingles virus. It can be used for any of the herpes viruses. Research has shown that it can be very effective at inhibiting the growth and replication of the varicella herpes zoster virus. I'll leave links below to the research studies. The suggested dose is 1,000 milligrams taken 3 times a day. And you'll want to begin taking this at the very first signs of any symptoms. Remember earlier I said if you can catch this virus at the earliest signs, like when you first begin to feel the tingling, prickling, etc., you may be able to prevent a full-blown outbreak. Once you recover from shingles, research has shown that taking 1,000 milligrams daily provides a good protection from future outbreaks. Okay, let's move on to number 3, olive leaf extract. Another important treatment is olive leaf extract. This compound comes from the leaves of olive trees. Its active compound is oleoropin, which has been proven to be extremely potent antiviral, antibacterial, and it can eradicate protozoan, which is a type of parasite. Now, research studies have shown that taking 500 to 1,000 milligrams to be extremely effective against viruses in general. For our patients, we place them on a much higher amount than this. Typically, we'll put them on 1,500 milligrams to 3,000 milligrams daily, depending on the severity of their symptoms. Other nutrients that can help with your recovery are vitamin C and zinc. Now, we recommend 1,000 milligrams of vitamin C 3 times per day and 30 milligrams of zinc twice daily. We also recommend a couple of topical applications for the blisters. The first one is an essential oil mixture recipe that we developed based on research to help with the pain and the symptoms. Now, here's what you're going to need. You'll need a tablespoon of castor oil, and now also make sure it's cold pressed and organic. You'll need 21 drops of vitamin D3 serum. Now, this is a liquid form of vitamin D. You'll need 7 drops of helichrysum oil, 6 drops of geranium oil, 4 drops of tea tree oil, and 7 drops of peppermint oil. Mix these ingredients together and apply to the area of the lesions. You can apply this several times throughout the day or really as often as needed in order to ease the pain. Now, another topical ointment that you can use is Manuka honey. Now, this is a raw honey from New Zealand that has potent antibacterial and antiviral properties, so it can actually protect against secondary bacterial infection. You can buy regular raw Manuka honey, but it should have what's called a UMF rating of at least 15 plus. This represents the potency of the antibacterial activity in the honey. The higher the rating, the more potent the activity is. Now, don't confuse the K factor rating, which is simply an arbitrary rating made up by the manufacturer. You can also buy a product which is called wound honey, which is made up of Manuka honey. Either one of these can be used on the shingles lesions, open sores, wounds, or even burns. The next topic I need to go over is post-herpetic neuralgia, or PHN for short. This is a long-lasting nerve pain in the areas of your skin where you had the shingles outbreak. The shingles virus can last anywhere between 2 to 6 weeks. PHN is diagnosed when the nerve pain lasts longer than 30 days. This can happen when the nerve fibers in the affected areas become damaged from the virus, and this condition can last anywhere from months or years. Now, the good news is that damaged nerves caused by the shingles virus can be repaired. You'll first need to start with a good quality nerve support formula. If you're not sure what that is, you'll need to watch our video, Vital Ingredients for Nerve Repair and the Right Dose. In these two videos, we'll cover exactly which nutrients research has proven to be effective for nerve repair, including for PHN. And we'll also go over the appropriate amounts that research has shown as being effective. Next, for faster and more complete healing, you may also need photobiomodulation, and we have a couple of videos on this topic too. I'll include those links for you. So remember, health warriors, shingles can absolutely be avoided. The key is safeguarding and fortifying your immune system. Research scientists have found that those with weakened immune system will get outbreaks more frequently. So the trick is to keep your immune system strong with a healthy lifestyle, such as good dietary habits, plenty of exercise and sleep, and minimizing toxic exposure. Learn to recognize the signs and symptoms of shingles from the initial onset, and then hit the shingles virus with an arsenal of immune boosting products such as vitamin D3, vitamin C, olive leaf extract, and zinc to stop it dead in its tracks. So there you have it, health warriors. You're now armed with the knowledge to stay happy, healthy, and strong. Before you go, I have a small favor to ask. It's our goal to develop a neuropathy-free world, and we need your help to do that. Please like our video and share it with friends and family, and don't forget to subscribe to our channel so you get notified as soon as we publish new content. Until next time, my friends, I look forward to seeing you on the road to great nerve health. Wait for it, because that's for sure she was gonna jump up. Ready?
Yeah.
Can you hear that?
Yeah.